There's a ritual most of us follow without question. Wake up, brush, swish some mouthwash, spit. Done. It feels clean. It tastes fresh. And for a few hours, your breath is minty and your mouth feels sanitized. But here's what nobody tells you about that routine. It might be doing less than you think. Because while mouthwash can mask symptoms, bad breath, surface bacteria, it doesn't address the deeper issue that leads to gum problems in the first place, inflammation. And inflammation in your gums isn't just about discomfort or bleeding. When you floss, it's a signal, a sign that something beneath the surface is breaking down, that the tissue supporting your teeth is under attack. And if you've been relying on mouthwash to fix that, you've been treating the smoke, not the fire. But what if there was something simpler, something that's been used for thousands of years across multiple cultures, specifically for gum health, something that doesn't just cover up the problem, but actually works with your body to reduce inflammation, support tissue repair, and create an environment where healthy gums can thrive? That's where oil comes in. Not just any oil, but a specific type that has properties most people never learned about in their standard dental hygiene education. And before you dismiss this as some fringe alternative remedy, understand this. The mechanism behind why it works is rooted in biology, in how your gum tissue responds to certain compounds, in how inflammation is triggered, and how it can be calmed. This isn't about replacing your dentist. It's about giving your gums what they actually need to stay healthy, instead of just what tastes good or feels clean. So if your gums bleed when you floss, if they're red, swollen, or tender, if you've noticed recession or sensitivity, or that your teeth just don't feel as stable as they used to, you need to understand what's really happening. And more importantly, what you can start doing today to shift the trajectory. We've left a guide in the first link in the description that breaks down exactly how to use this method safely and effectively. Click and see how it fits into a complete gum health strategy. Because healthy gums aren't just about avoiding the dentist, they're the foundation that holds everything else in place. What mouthwash actually does, and what it doesn't. Let's start with the truth about mouthwash. Most commercial mouthwashes are designed to do a few specific things: kill bacteria, freshen breath, and create a sensation of cleanliness. And they do that, temporarily. The active ingredients, usually alcohol, chlorhexidine, or essential oils like menthol and eucalyptal, are antimicrobial. They reduce bacterial load in your mouth for a short window of time. But here's the problem. Your mouth isn't supposed to be sterile. It's an ecosystem, a balanced environment where beneficial bacteria coexist with harmful ones. And when you use a broad-spectrum antimicrobial rinse every day, you're not just killing the bad bacteria, you're wiping out the good ones too. And that disrupts the balance. Over time, this can actually make things worse, because once the mouthwash wears off, which happens within hours, the harmful bacteria repopulate, often faster than the beneficial ones. So you're stuck in a cycle: rinse, feel clean, bacteria return, rinse again. But the underlying inflammation, the gum recession, the tissue breakdown, that doesn't get addressed, because mouthwash doesn't reduce inflammation. At the cellular level, it doesn't support tissue repair. It doesn't deliver the nutrients or compounds your gums need to rebuild and strengthen. It's a surface solution to a deep problem. And here's the part that really matters. Gum disease, gingivitis, periodontitis, isn't just caused by bacteria. It's caused by your body's inflammatory response to bacteria. The bacteria produce toxins. Your immune system responds with inflammation. And that inflammation, when chronic, breaks down the connective tissue and bone that hold your teeth in place. So if you're only killing bacteria, you're missing half the equation. You need something that addresses the inflammation itself, something that calms the immune response, that supports the gum tissue, that creates an environment where healing can actually happen. And that's where oil, specifically certain anti-inflammatory, antimicrobial oils, becomes a game changer. The oil that changes everything. So which oil are we talking about? Clove oil. And before you think that's just something my grandmother used, let me explain why it's one of the most scientifically validated natural compounds for gum health. Clove oil contains a compound called eugenol. Eugenol is a phenolic compound with powerful anti-inflammatory, antimicrobial, and analgesic, pain-relieving properties. It's been studied extensively in dental research, and the findings are clear. It reduces gum inflammation. It inhibits the bacteria most responsible for gum disease, particularly Porphyromonas gingivalis and Prevotella intermedia. It supports tissue healing by reducing oxidative stress in gum cells, and it does all of this without disrupting the beneficial bacteria that help maintain oral health. In other words, it's targeted, it's effective, and it works with your body's natural healing processes instead of against them. Dentists have known about eugenol for decades. It's used in temporary dental fillings, in root canal sealers, in topical analgesics for toothaches, but most people have never been told they can use it preventively, at home, as part of a daily routine to keep their gums healthy before problems develop. And that's the missed opportunity, because by the time most people seek out clove oil, they're already dealing with pain, swelling, infection. They're using it as a last resort, but it's far more effective when used proactively. When your gums are just starting to show signs of inflammation, redness, slight bleeding, tenderness, that's the window. That's when eugenol can make the biggest difference. It interrupts the inflammatory cascade before it becomes chronic. It supports the tissue before significant damage occurs. It gives your gums a chance to recover instead of just managing decline. And the best part? It's simple to use. You don't need expensive equipment. You don't need a prescription. You just need the right preparation, the right dilution, and the right application method, all of which we'll cover. But first, you need to understand what's actually going wrong when your gums start to break down. What's really happening in unhealthy gums? Here's what most people don't realize about gum disease. It's not an infection in the traditional sense. Yes, bacteria are involved. But the destruction, the recession, the bone loss, the loosening of teeth, that's caused by your own immune system. Let me explain. When bacteria accumulate along the gum line, they form a sticky film called plaque. If that plaque isn't removed, it hardens into tartar calculus, which provides a rough surface for even more bacteria to cling to. These bacteria produce endotoxins, waste products that irritate your gum tissue. Your immune system detects this irritation and responds with inflammation. White blood cells flood the area. Chemicals called cytokines are released to fight the infection. And in the short term, that's helpful. It's your body defending itself. But when the bacteria don't go away, when plaque keeps building, when the irritation becomes chronic, the inflammation doesn't shut off. And chronic inflammation is destructive. The enzymes and chemicals your immune system releases to fight bacteria start breaking down your own tissue. The collagen fibers that hold your gums to your teeth degrade. The bone that supports your teeth begins to resorb. That's periodontitis. And once it starts, it's progressive. It doesn't reverse on its own. Without intervention, it leads to gum recession, tooth mobility, and eventually tooth loss. But here's the critical insight. The damage isn't inevitable. If you can reduce the bacterial load and calm the inflammatory response, you give your gums a chance to stabilize, to heal, to stop the progression. And that's exactly what clove oil does. It reduces the bacteria that trigger the inflammation, and it modulates the inflammatory response itself, dampening the overactive immune reaction that's causing the tissue breakdown. It works on both fronts. And that dual action is what makes it so effective. How to use clove oil safely and effectively. Now let's get practical. Clove oil is potent, and that's a good thing, but it also means you need to use it correctly. Undiluted clove oil can irritate your gums, burn your mucous membranes, and cause more harm than good. So here's the protocol. Step 1. Dilute properly. You need a carrier oil, something neutral that won't interfere with the therapeutic properties of the clove oil but will reduce its intensity. Good options: coconut oil, olive oil, or sesame oil. The ratio: 1 drop of clove essential oil per teaspoon of carrier oil. That's a safe, effective dilution for topical gum application. Step 2. Apply to the gum line. Dip a clean cotton swab or your fingertip, washed thoroughly, into the diluted oil. Gently massage it along your gum line, front and back of your teeth. Focus on areas where you've noticed redness, swelling, or bleeding. Don't scrub, don't press hard. Just a gentle, circular motion that allows the oil to contact the tissue. Let it sit for a few minutes. You'll feel a slight warming or tingling sensation. That's the eugenol at work. Then rinse with warm water. Step 3. Use it consistently. Once a day is enough, preferably at night, after you've brushed and flossed, so the oil can work while you sleep without being immediately washed away by food or drink. Do this every night for 2 to 3 weeks. That's how long it takes to see measurable improvement in gum inflammation. You'll notice the redness fading, the bleeding decreasing, the tissue looking firmer, healthier. That's not placebo. That's your gums responding to reduced bacterial load and calmed inflammation. Step 4. Combine it with proper hygiene. Clove oil is not a replacement for brushing and flossing. It's a supplement. You still need to remove plaque mechanically. You still need to disrupt the biofilm that bacteria form on your teeth. But when you combine mechanical cleaning with the anti-inflammatory and antimicrobial properties of clove oil, you create a comprehensive approach, one that addresses both the cause, bacteria and plaque, and the consequence, inflammation and tissue damage. And if you want a complete system, how to integrate this into a full gum health protocol, what other supporting strategies to use, how to monitor your progress, there's a method explained in the pinned comment that walks through everything step by step. Because isolated tips are helpful, but a complete system is what produces lasting results. Why this works when mouthwash doesn't? Let's go back to the comparison. Mouthwash kills bacteria indiscriminately, disrupts your oral microbiome, and provides no anti-inflammatory benefit. Clove oil targets harmful bacteria, preserves beneficial microbes, and actively reduces inflammation. Mouthwash creates dependence. You need to keep using it to maintain the effect, and the effect itself is superficial. Clove oil supports healing. You use it to interrupt a problem, allow your tissue to recover, and then maintain health with less frequent application. Mouthwash is reactive. You use it after your gums are already irritated, and it doesn't address the root cause. Clove oil is proactive. You can use it at the first sign of trouble, or even preventively, to stop inflammation before it progresses. That's the difference. One masks symptoms, the other resolves them. And if you've been stuck in the mouthwash cycle, constantly rinsing but never seeing real improvement, this is your way out. But here's the thing, it requires a mindset shift, because mouthwash is easy, it's habitual, it's what everyone does. Clove oil requires intention. You have to prepare it, apply it, be consistent with it. But that small amount of extra effort, it produces exponentially better results, because you're not just freshening your breath, you're rebuilding the foundation of your oral health. What happens if you ignore gum health? Let's be clear about what's at stake. Gum disease is the leading cause of tooth loss in adults, not cavities, not trauma, gum disease, and it's progressive. It doesn't plateau, it doesn't resolve on its own. If you ignore early signs, bleeding when you floss, redness, slight swelling, they become advanced signs. Gum recession, pockets forming between your teeth and gums, bone loss, tooth mobility, and once you reach that stage, the treatments become invasive. scaling and root planing, deep cleaning under the gums. Antibiotic therapy, gum grafts, bone regeneration procedures. These aren't minor interventions. They're painful, expensive, and time-consuming. And even with treatment, you're managing damage. You're not restoring what was lost, because gum tissue and bone don't regenerate easily. Once they're gone, they're gone. But here's the critical point. All of that is avoidable if you catch inflammation early, if you address it with the right tools, if you don't wait until symptoms force you to act. That's why this matters so much. Not because clove oil is some miracle cure, but because it gives you a tool to intervene early, when intervention is still simple and effective. The bigger picture: gum health and systemic health. Here's something most people don't connect. Your gum health affects more than just your mouth. There's a growing body of research linking periodontal disease to systemic conditions: heart disease, diabetes, respiratory infections, rheumatoid arthritis, even Alzheimer's. The mechanism is inflammation. Chronic gum inflammation doesn't stay localized. The bacteria and inflammatory mediators can enter your bloodstream. They circulate. They contribute to systemic inflammation. And systemic inflammation is a driver of almost every chronic disease. So when you ignore your gums, you're not just risking tooth loss, you're increasing your risk for conditions that affect your entire body. That's why dentists and physicians are starting to talk more about the mouth-body connection. Why gum health is no longer seen as purely cosmetic or optional. It's foundational. And anything you do to reduce gum inflammation, whether it's better brushing technique, regular flossing, or using anti-inflammatory agents like clove oil, has benefits that extend far beyond your teeth. You're reducing systemic inflammation, you're lowering your disease risk, you're supporting your overall health. That's the bigger picture. And that's why taking gum health seriously isn't vanity. It's self-preservation. Why most people wait too long. So if all of this is true, if gum disease is preventable, if early intervention works, if the tools are accessible, why do so many people still end up with advanced gum problems? Because the symptoms are subtle. Gum disease doesn't hurt. Not at first. There's no sharp pain that forces you to pay attention. No sudden crisis that demands immediate action. Just a little bleeding when you floss, a little redness, a little tenderness, and it's easy to dismiss. I probably just brushed too hard. It's nothing serious. I'll mention it at my next dental appointment. But by the time you mention it, months have passed, maybe a year, and the inflammation has been working the entire time, breaking down tissue, eroding bone, creating pockets that trap more bacteria and make the problem worse. And suddenly what could have been addressed with daily clove oil application and better hygiene now requires professional intervention. That's the trap. Gum disease is silent until it's not. And by the time it's loud enough to get your attention, you've already lost ground. So the question is, are you going to wait for it to get worse, or are you going to act now while it's still simple? The truth about natural remedies. Let's address the skepticism. Because when people hear use oil for gum health, some immediately think it's pseudoscience. Some folk remedy without evidence. And that's fair. There's a lot of bad information out there. A lot of miracle cures that don't hold up under scrutiny. But clove oil isn't one of them. Eugenol has been extensively studied. There are peer-reviewed papers on its antimicrobial activity, its anti-inflammatory properties, its efficacy in reducing gum disease markers. It's not anecdotal, it's documented. And it's not instead of conventional care, it's in addition to. You still need to see a dentist, you still need professional cleanings, you still need to address tartar buildup that you can't remove at home. But between those visits, you need something that keeps your gums healthy. That prevents problems from developing. That gives your tissue the support it needs to stay strong. And clove oil does that. Not because it's natural, but because it's effective. The fact that it's been used for thousands of years across multiple cultures is a point in its favor. It suggests safety and sustained benefit. But what makes it credible is the science, the measurable reduction in gingival inflammation, the documented antibacterial activity, the clinical evidence showing it works. So if you've been dismissing this as just another natural remedy, look at the research and then decide based on evidence, not assumptions. How to know if it's working? One of the challenges with preventive care is that results aren't always dramatic. You're not fixing a crisis. You're preventing one. So how do you know if the clove oil is actually making a difference? Here's what to look for. Reduced bleeding. If your gums bleed when you floss or brush, that's a sign of inflammation. Within 2 weeks of consistent clove oil use, you should notice less bleeding, eventually none at all, less redness. Healthy gums are pale pink, inflamed gums are red, sometimes dark red or purplish. As inflammation decreases, the color should normalize. Firmer tissue. Swollen, puffy gums are a sign of fluid accumulation and inflammation. As that resolves, the tissue should feel firmer, tighter against your teeth. Decreased sensitivity. If your gums are tender to the touch or sensitive to temperature, that should improve as the inflammation calms. Fresher breath. Gum disease often causes bad breath because of the bacteria and tissue breakdown. As your gum health improves, your breath should improve too. These aren't overnight changes, they're gradual, but they're measurable. And if you're tracking them, taking note of what your gums look like and feel like before you start, and then checking again after 2 weeks, 4 weeks, 6 weeks, you'll see the progress. That's how you know it's working. Not because someone told you it would, but because your own body is showing you the evidence. What happens next? So here's where you are. You've learned what mouthwash doesn't do, what clove oil does, how gum inflammation works, and how to interrupt it. You know the protocol. You understand the stakes. Now it comes down to action. And this is where most people hesitate, not because they don't believe it will work, but because it feels like one more thing to add to an already full routine. But here's the reality. This takes 2 minutes, once a day. That's less time than you spend scrolling on your phone before bed. Less time than you spend choosing what to watch on TV. And in exchange for those 2 minutes, you get healthier gums, stronger tissue, a reduced risk of tooth loss, systemic disease, and expensive dental procedures. The ROI is absurd, but only if you actually do it. So don't let this be another piece of information you consume and forget. Let it be the thing that changes your approach to gum health. Starting tonight, dilute the oil, apply it, let it work, and do it again tomorrow, and the day after that, because consistency is what separates people who maintain healthy gums from people who lose teeth they could have saved. And if you want a complete system, how to combine clove oil with other evidence-based strategies, how to monitor your progress, how to know when professional intervention is needed, check the pinned comment. There's a method designed specifically for people who want to take control of their gum health before problems become crises. Because your gums are the foundation. Everything else, your teeth, your bite, your ability to eat comfortably, your confidence when you smile, depends on them. So take care of them. Not someday, not when it gets worse, now. If this gave you a new perspective on gum health, subscribe to the channel. There's more coming that can help you understand your body better, make smarter decisions, and stay ahead of problems before they escalate. Your gums are worth it. You're worth it. And the time to act is tonight.